Primary herpetic gingivostomatitis is on the rise. Today we are here to discuss the etiology, the historical significance, the symptoms, the treatment, the effects on the individual, and the effects on dental hygiene treatment. I'm Madison Lowe, and this is 1062 International News. The etiology of primary herpetic gingivostomatitis is the herpes simplex virus, in which an individual is initially reacting to it. HSV is double-stranded and is part of the human herpes virus family known as Herpetoviridae. Type 1 is the most common manifestation and is associated with the oral cavity. The duration of this virus is quite short, that is self-limited and resolves in 1 to 2 weeks after onset. The incubation period is 2 to 12 days. This means after coming into contact with this virus, 2 to 12 days pass before the clinical signs and symptoms of the infection begin to show. The initial infection is called primary herpetic gingivostomatitis, but when the infection comes out of its latent period, it manifests as a recurrent herpes simplex virus. It can be in a latent stage and recur regularly to seldomly ever. Though there is not a specific time in history when the primary herpetic gingivostomatitis infection was discovered and documented, the first documentation of the herpes simplex virus was by the Greeks and was described as a sore that began to creep over the surfaces of the skin. It was also first demonstrated by Vidal in 1873 that the herpes simplex virus is caused by human inoculation. There is speculation that approximately 2,000 years ago, Tiberius, the Roman emperor of that time, attempted to subside the herpes simplex virus epidemic by banning kissing during public ceremonies and rituals. The herpes simplex virus has been around for a very long time, and we have seen it steadily increase. 90% of individuals worldwide have one or both types of the herpes simplex virus. In the U.S., 65% of individuals have the antibody for type 1. Primary herpetic gingivostomatitis is distributed evenly among gender and race groups with no predilection to either. Primary herpetic gingivostomatitis is highly contagious. Because of this, it is suggested that any periodontal instrumentation of the teeth should be postponed until the initial infection subsides, and contact should be avoided in the child's mouth, as the infection is primarily spread through their saliva. All members of the dental team should adhere to the universal precautions for infection control. The American Academy of Oral Medicine recommends delaying care until the herpes simplex virus is scabbed over or completely healed in order to minimize recurrences and spread of infection, and that the presence of an oral or perioral lesion is a reason for deferral of care. In most patients who experience this initial infection, signs and symptoms are subclinical. This means they cannot be seen through the naked eye. However, in some patients, clinical symptoms can be extremely severe. This viral infection usually occurs in infants and children who are under the age of 6 years old. Systemic symptoms to be noted include fever, malaise, and cervical lymphadenopathy. Following the systemic symptoms, painful erythematous and swollen gingival mucosa that bleeds easily can be observed, as well as small vesicles on the perioral skin and vermilion border that burst and leave painful ulcers in their place. These ulcers are surrounded by a red halo. This infection undergoes several stages before healing. These stages include prodrome, macule, papule, vesicle, ulcer, scab, healed area of redness, and then complete healing. The two most important stages in dentistry are the vesicle and ulcer stages. This is because the vesicle contains actively reproducing particles, and then when ruptured during the ulcer stage, this fluid can be spread around the mouth and to the clinician. The diagnosis is typically made through clinical observation. However, if additional testing is necessary, a direct immunofluorescent exam of ulcer scrapings or blister fluid can be conducted. Treatment for patients who have primary herpetic gingivostomatitis is primarily supportive. This is to keep the patient as comfortable as possible while the infection runs its course. Topical oral anesthetics like lidocaine 2% or Orobase with benzocaine can be used to control any discomfort the patient may be experiencing. which will allow them to eat and drink with ease. Antivirals such as acyclovir can be used, as well as antipyretics to reduce the fever, and systemic analgesics to control pain. The antivirals are most effective if taken within 72 hours of the lesion appearing. Drink plenty of liquids to avoid dehydration, but be wary of acidic or citrus-type drinks as those can cause discomfort. Cold foods like ice cream or popsicles can have a soothing effect on the mouth. Regularly brushing and flossing twice a day is crucial to keeping bacteria out of the affected areas. If brushing is too painful, have the child wipe their teeth with a damp washcloth. If you are the one caring for the child, make sure to wash your hands after handling them to avoid any spread of the virus. Children who are infected should keep their hands out of their mouths and avoid touching their eyes or other parts of their body. The patient may experience malaise or the feeling of discomfort, along with the other painful oral manifestations and dehydration. This is because eating and drinking can sometimes be unbearably painful for the patient, to the point where they don't even want to eat or drink anything. The stigma that comes along with having herpes can be mentally and emotionally distressing. Though a majority of the population has one or both types of herpes, it can at times feel embarrassing. Stress and fatigue are emotional triggers that cause the virus to come out of inactivity. Learning to manage stress and fatigue can reduce the frequency in which you get the oral manifestations. As previously stated, it is recommended that the individual defer their appointment until their lesion has crusted or healed, so there is no risk of disease transmission to other areas of their mouth or to the clinician. Thank you for tuning in. This is Maddy Lowe with 1062 International News. We'll see you next time.